How does vitamin D affect reproductive capacity? Have you ever wondered how vitamin D might influence reproductive health? This fat-soluble vitamin is crucial for many bodily functions, including fertility. Research shows that vitamin D plays a significant role in reproductive capacity for both men and women. Vitamin D is essential for calcium absorption and bone health, but it also affects hormone regulation and immune function. In reproductive tissues like the ovaries, uterus, and testes, vitamin D receptors are present. This suggests that vitamin D directly impacts reproductive processes. For men, vitamin D deficiency can lead to reduced fertility. Studies indicate that adequate vitamin D levels improve sperm quality. This includes better sperm motility and higher numbers of mature sperm. Vitamin D also supports the activity of enzymes in testicular cells, which are vital for sperm production. When vitamin D levels are low, it can result in hormonal imbalances and lower sperm quality, potentially leading to infertility. Women also benefit from sufficient vitamin D levels. This vitamin is important for ovarian function and regulating reproductive hormones. Low vitamin D levels have been linked to conditions such as polycystic ovary syndrome, which can affect fertility. Some studies suggest that women with adequate vitamin D levels may experience higher pregnancy rates, especially during fertility treatments like in vitro fertilization. Another area of interest is the connection between vitamin D and endometriosis. This condition involves tissue similar to the uterine lining growing outside the uterus. Endometriosis is often associated with inflammation and immune system issues. Vitamin D has anti-inflammatory properties, and some research indicates that higher vitamin D levels might lower the risk of developing endometriosis or reduce its severity. However, more studies are needed to fully understand this connection. To support reproductive health, consider ensuring you have enough vitamin D in your diet. Foods rich in vitamin D include fatty fish, egg yolks, and fortified dairy products. Sunlight exposure is another great way to boost your vitamin D levels. However, many people struggle to get enough vitamin D from food and sunlight alone, especially in areas with limited sun. Before starting any vitamin D supplementation, it is essential to consult a healthcare professional. Both deficiency and excess of vitamin D can lead to health issues. Personalized medical advice is crucial, particularly for those with specific health conditions or those undergoing fertility treatments. In summary, vitamin D is vital for reproductive health in both men and women. It influences hormone balance, sperm and egg quality, and may even affect conditions like endometriosis. While more research is needed, maintaining adequate vitamin D levels is a practical step towards supporting reproductive capacity. Always consult a qualified healthcare provider for tailored recommendations.